Hi there, my name's Tom and I'm going to be taking you through the bench press today. So the bench press is a very popular exercise within weightlifting. This is a really good exercise for building those chest muscles. Okay, so we start in this position here, laying down on the bench. Make sure the bench is the right height for us, so it's not so high that we're up on our tiptoes with the feet and we're straining to get up there. Make sure it's not too low, so we've got too much flexion in the knees and we're crouched down. Throughout the whole movement, we make sure we've got the 4 points of contact. So our head, the back of the shoulders, the back of the hip should always be in contact with the bench, and our feet should be nice, solid, stable base on the ground. We don't push our back fully into the bench. We maintain that little bit of natural arch, just so we maintain that neutral spine. Right, from here, so we start off, we grip the bar nice and tightly, especially if you've got a heavy weight on there. You grip it, make sure you've got a nice tight grip. Your fingers inverse to your thumb, so there's no chance for the bar to roll out, because this could cause injury to the chest or even worse the neck if you've got a falling weight. When we're doing the movement, make sure the bar should be over our elbows at all times, and then you should drive the bar straight up in a press. Okay? So when we're pushing the bar up, can you push the bar up for me? There you go. So we've got an extension at the elbow here, and we've got an adduction of the shoulder. The main muscles we've got working in this exercise is the agonist, the pectoralis major. We've got the antagonist, the latissimus dorsi. The synergist will be the tricep back here, and the anterior deltoid, which is here. The stabilizers will be this rotator cuff group of muscles right here. They're just making sure the shoulder is staying nice and stable through the movement, so you're not moving about too much. Okay, so as you press up in the concentric phase, it should be a nice big breath out. Okay, and as you bring the bar back down, big breath in, so big breath out, and breathe in. There you go. Okay, so a couple of things we've got to look out for when we see clients doing this exercise. We've got a few things that could go on with the bar. So as some people push up, the bar may come too far forward, or the bar may come too far back. Okay, we don't want to be doing this, because especially if you've got a heavy weight, you might be pulling the shoulders too far back or too far forward, and this could cause injury in the shoulder, and as well we could drop the weight backwards, possibly causing someone else or ourselves even more injury. As well, when we're doing this exercise, we make sure sometimes the client, especially if they're getting to sort of the end of their rep range, they'll start pushing a lot more force with one arm than the other. So we've got a lot of instability here. You'll see the bar tilting to one side. We don't want that. We want to maintain the bar straight all the way through the movement. So maybe we need to drop the weight and progress that before we move up a weight if we're getting too much lag. Also, as we bring the bar down, we want to stop before the chest. We don't want to be bringing it all the way down to our chest, because from there we can bounce it back up and we're not working the muscles properly. Also, there's another chance of injury there. Okay, so once we've done that, we can start to progress the movement. So we can start off with our hands. So if you do a nice close grip for me. Okay, so if we do a close grip, we're going to start to work more of this central pectoral area, so more around the sternum. If you do a wide grip in the hands for me. Okay, so with the wide grip, we're going to start to work more of this lateral pectoral, the sort of outside. Once we go back to shoulder width. So once we've done the hands, we can go elbows. So with the normal bench press, we're going to be working this middle region of the pectoral. If you go to a close position with the elbows, if you bring the elbows more into the body, that's when you're going to start working more of this top and bottom area of the pectoral. Okay, so once we've done that, we can, if you want to be a bit more specific with your upper and lower pectoral, we can also do an incline and a decline bench press. We have to use a modified bench for this. So the incline is where you'll be at this kind of angle, your head's up here, and your feet will be down here. And that's going to work more of this upper pectoral and more of the serratus down here. We can also do a decline where your feet will be up here and your head will be down here. That's going to work a lot more of this lower pectoral region. Okay, so the bench press is a really good exercise to do for most people, but we have got to consider a couple of populations in the movement. Pregnant women, especially after the first trimester, this is probably not a good exercise to do, seeing as the laying down is going to take the blood away from the baby, it's is also going to put more strain on this abdominal area. That's what we don't want. Another population is if you've got heart disease or high blood pressure, anything like that, we don't want to be doing this movement at all, because with the laying down and the exertional force going up, it's going to put a lot more pressure on this chest cavity. Okay? When you're doing this movement, you'll always make sure you've got a spotter with you, so someone standing up here, so as you push up, you've got someone just following you up with the weight, so if you happen to drop the weight, or if you feel an injury go, you've got someone to grab the bar, and they can bring it back for you. With any elderly or obese patients, you may want to have either like a box here maybe, or someone else here, just to help them get up and down from the bench, because they do find it hard laying down, and especially getting back up from that laying down position. Okay, so my name is Jeffery, and that's the bench press.